Welcome to Between the Sheets, the non-judgmental podcast where we're going to cover various sexual health and wellness topics. I'm your host, Dr. Stephanie Zwanitzer. I'm a urology and sexual health nurse practitioner, and I love helping my patients and listeners discover and develop their most satisfying sexual experiences. Between the Sheets is here to normalize the conversations about sexual health and cover everything from basic anatomy to the most taboo topics and everything in between. Real talk, real pleasure, one episode at a time. So come on, let's get between the sheets. This episode is sponsored by Boston Scientific and its educational website on erectile dysfunction, edcure.com. One study estimated that more than 50% of men over the age of 40 have some degree of erectile dysfunction, which can be frustrating and confusing. Go to edcure.com to find information on erectile dysfunction and treatment options, including long-term treatment options offered by Boston Scientific. Boston Scientific does not endorse any statements or opinions expressed during this episode. Welcome back to Between the Sheets. I am happy that you are with us today, and I'm also happy that I have a fabulous guest, Dr. Sarah Reardon. She is a pelvic floor specialist. You know, by listening to me, this is one of my favorite topics because our pelvic floor is so important and we ignore it so much. So welcome, Dr. Sarah. Thank you so much for being here.
Thanks for having me.
Yes. And I'm going to let Sarah tell you a little bit more about herself. She has a book. She has a practice. She has an app. She's got lots of different things. So do you want to tell us a little bit more about yourself?
Absolutely. So I am a board certified pelvic floor physical therapist. I've been practicing for 19 years and was doing pelvic floor therapy immediately after graduate school because I really loved working with women. I work with all genders now. I work mainly with women or people with vaginas. And I really love educating people about their bodies and helping them get support and relief from something or symptoms they didn't know there was even help for. So I've been practicing in this field for 19 years. I have 2 boys. And I recently published a book called Floored, A Woman's Guide to Pelvic Floor Health at Every Age and Stage, which you can buy wherever you like to buy books. And it's just a really great entryway into understanding the pelvic floor. It's very accessible. There's patient stories in there. It's lighthearted and funny, not overly medical, but really demystifying the pelvic floor at every stage of life. It goes from puberty to postmenopause. And then I released an app this past year called the V-Hive, which has pelvic floor and core workouts for at home, and particularly a pregnancy, postpartum, and perimenopause programs, which are the times in life when we really start experiencing pelvic floor changes. And if we don't get support for them, we often feel like we just have to live with them. And yet there are so many solutions out there.
Yeah, you're right on. And it's amazing that, especially for women, listen, men have a pelvic floor too, and we are not negating that. It's very important for them as well. But for this particular discussion, I love that you have focused on these main times in a woman's life, because what's so fascinating for me and how much I love hormones work is these are all times in a female's life that she is going through major hormonal shifts. Pregnancy, we're flooded with hormones. Postpartum, we're trying to get back to our normal. Perimenopause and menopause, we're losing all of our hormones. So these are major times that a lot of stuff is going on in the female body. And we kind of forget that there are certain things that we can do, stretches, strengthening, exercising, things like that, that benefit not only pain with sex, which is a huge factor for a lot of women, but lubrication, infection prevention, frequency and urgency of urination. There's so many things that happen. And I agree with you. The most I see it in women are during those major hormonal shifts in life.
Yeah. And, I think we carry so much as women, to care for ourselves, to care for our families, all of these things. We often say like, oh, we forget, but I actually think we've never been taught about our pelvic floor. I think when I released the book in June of 2025, the most frequent question I've received after that is, how do I teach my kids about this? Because we were not educated when we were younger. We're barely educated as adults until we start experiencing a problem. And so, we're really shifting towards how do we help the next generation understand this part of their body better, even knowing that it exists, what's normal and what's not. Like little leaks of urine, not normal. Painful sex, not urine. Cesarean scar pain, not normal. Our urgency and frequency of urination, not normal. I don't even wanna put it on us like we forgot. I'm like, "Nope, nobody taught us." And so
It's
but
so
now we
true.
do have to learn it so that
Yeah.
we can care for our bodies and our pelvic floors, especially during the second half of our lives.
Yeah, absolutely. And just to touch on our guys here for a little bit, because you may be listening and keep listening because you'll be able to help the women in your lives as well throughout this discussion. But some of the things that I have seen men for in the urology clinic and then have sent them to lovely pelvic floor specialists. Testicular pain, that there isn't an infection or a cause for pain after sex. A lot of them will get really tight after sex. And then certainly post prostate cancer treatment, whether their prostate was removed or they got radiation, working through those. Do you see those patients and what else do you see men for?
Absolutely. So, often things related to the prostate. So, if there's a prostate procedure or a surgery to remove the prostate due to cancer, we can tend to see erectile dysfunction and urinary leakage. So, those are the number two things. And actually, there's a muscle component, a very important one in both of those symptoms and both of those functions. So, pelvic floor therapy plays a crucial role after that surgery. I also see men, I would say it's less of a weakness issue in men, and it's actually more of a tension coordination issue. So this may manifest in difficulty starting your urine stream, frequent urination, incomplete bladder emptying, pain with urination, pain with bowel movements, incomplete bowel movements, as you mentioned, testicular pain, and often what we call like chronic prostatitis, but yet there's no infection. So they've been treated frequently for urgency and pain, but there's no infection. So we're just continuing to throw antibiotics at them when there's actually no bacteria that's causing those symptoms. It's pelvic floor muscles. And then even sexual health. So the inability to maintain an erection, premature ejaculation, and difficulty reaching climax or orgasm. Those are complex issues, but the pelvic floor muscles play a crucial role. And so, again, kind of helping with those symptoms can be what we do in pelvic floor therapy as well for male bodies.
Yeah, that's awesome. And it's one of the things that I've learned too with erection and orgasm issues is how much that can really help, guys who it's kind of like hit or miss. Obviously, it's not going to do dream work for men who just are on the antidepressants, the hypertensive meds, the diabetes medicines, and they're overweight. They're all these other things stacked against them, right? But if you're early onset or you're post surgical or you're super tense, have you noticed that it's engineers? I get so many engineers,
I
so
get a
many
lot of
engineers.
I get a lot of business consultants.
Do you?
Yeah, and this was more pre-COVID because consultants traveled every week. They were on planes. They had, off schedules with eating and exercise and sleep, and they were stressed. And I was like, oh my gosh, business consultants are going to keep this practice going. It's less so now, but it's engineers who tend to be sitting a lot, clenching a lot, kind of holding tension in their bodies unknowingly. And so, yes, the
Yeah.
cerebral folks, their
Yes.
pelvic
It's so
floors need a
funny.
little relaxation.
Yeah, where I'm located in Maryland, I'm near NSA and a lot of government buildings and things like that. And so we have these like high stress individuals, and they'll come in complaining of like chronic prostatitis type symptoms or this random testicular pain that we can't diagnosed for any other reason. And I send them to pelvic floor physical therapy and they like roll their eyes at me like, Steph, this is not going to work. Like, what are you doing? I don't need to go to physical therapy. My balls hurt, And I'm like, no, I promise it's really good. And they'll come back to me and be like, holy cow, you were right. And I'm like, yeah,
I
because we
know.
do. It's the basis for so much of what we do. So, talk to me a little bit about the pelvic floor and why this is so important in our lives and so many aspects of our livelihood in the pelvis.
The pelvic floor is a basket of muscles that sit at the bottom of your bony pelvis. So if you can imagine a skeleton, you've got those kind of elephant ear shaped bones. At the bottom, we typically see an opening, but within our bodies, that opening is actually covered by a floor of muscles. And that's what we call the pelvic floor muscles. Those muscles in female bodies have three openings, one for the urethra where urine exits, one for the vaginal opening for vaginal birth, menstruation, vaginal intercourse, and then the anal opening for bowel movements. In male bodies, there's two openings, one for urine to exit, urine and semen to exit, and then one for the anal opening. So these muscles kind of hold in our bladder and bowel contents. They help with sexual function, reproductive function. But this muscle also is a hammock that supports your pelvic organs. So your uterus, ovaries, bladder, balls in females, the prostate, bladder, balls in males. And it works with your core. So your abs, your low back, it supports your spine, gives you core strength. It helps with bowel movements. And again, bladder function, and sexual function. So, the interesting thing about our medical system right now is that we have so many experts, but they're in a particular system of our body. We have a GI doctor and a colorectal doc. We have a urologist. We have, pain management specialist. But the physical therapists like myself are the muscle specialists, and the muscles cross over all of these different systems and functions. The good news is that by the time folks get to us, they're like, okay, I don't have cancer. My cancer's been treated. Okay, I don't have a major disease process, but I'm still suffering. And so when we really look at the muscles, we can get a gentleman coming in with testicular pain and he's like, I need to get it removed. I'm like, you probably just need some work to your abdominal wall, And so but I think but we've also seen this with female bodies where they have uterine pain or abdominal pain or menstrual pain, and their pelvic floor muscles are a component, and they've had their uterus removed. I've had women who've had their labia removed, but it's their muscles that are a contributing source of their dysfunction. So we work with the muscles, whether it's strengthening them, whether it's relaxing them and coordinating them, just like a physical therapist would work with any other muscles in your body.
Yeah. And one thing that I always like to tell my patients about is unlike other therapy where you broke your arm or got a surgery and you go to 12 weeks of therapy and you're checked off and you go live your life, pelvic floor therapy is for life. You guys are great at giving patients exercises to do at home, homework, whatever. And I'll have patients that do so wonderful. And then a year later, they're like, I'm back to where I was. I'm like, well, how have you been doing with your exercises? Well, I'm done with that. No, not with the pelvic floor.
Yeah. The interesting thing is with those other kind of orthopedic injuries, like a break or a fracture or surgery, it's something sudden, right? Like you
Mhm.
tore your ACL in this movement. But with pelvic floor stuff, it tends to be insidious and gradual. And then we finally get help for it when we're either referred or it gets so uncomfortable or impacts our quality of life that we're like, that's enough. I got to go handle this. And so it is something that, I tell people it's more like brushing and flossing your teeth. Like if you get a cavity, you go get it fixed. Like if you have a pelvic floor issue, you go to pelvic floor therapy. But you can't quit brushing and flossing your teeth, right? Because then the cavity is going to come back. So it's the same thing. Integrating some of these habits and exercises and just awareness into our day to day lives is what's going to give you longevity and relief.
Yeah. That's such a great I love that analogy. That's so great. I may steal that and start using
No,
that with my
please don't. But
patients.
sometimes people are like, "But Sarah, I hate the dentist." I'm like, "Okay, well, just take that off the table." But you get the picture, right?
Yes, absolutely. So let's talk through some of these areas that you really focus on with women. So we don't have a large listening population that are going through pregnancy and postpartum, but let's touch on that before we get to the meat and potatoes of perimenopause and menopause. So talk to me about pelvic floor physical therapy in pregnancy and what that's going to help our ladies with.
In my ideal world, we would have moms starting to come to pelvic floor therapy during pregnancy because we know the pelvic floor goes through changes. It is not part of our healthcare system right now. So, three things that I think pelvic floor therapy can help with is, these pelvic floor muscles, as I mentioned, sit like a basket and they support
Mhm.
your uterus, and your uterus is supporting a growing fetus during pregnancy. This hammock of muscles in the early days, you get those text messages or app updates that say your baby's the size of a lemon, then it's the size of an avocado, then it's the size of a watermelon. And this hammock of muscles, when you have a lemon or an avocado in a hammock, it doesn't change that much. But if you put a watermelon in a hammock, that hammock's going to stretch out, it's going to sink lower, it's going to get a little bit weaker. And that's what happens to your pelvic floor during pregnancy. You can start to experience urinary leakage, pelvic heaviness, vaginal heaviness or pressure, abdominal separation called diastasis recti, hemorrhoids, these kind of things that start to pop up during pregnancy. So if we can address them earlier, the research is clear that your outcomes postpartum are better. So I'm a huge fan of going. The other thing is that the aches and pains we often think of during pregnancy, like sciatica or pubic bone pain or lightning crotch, those can also be helped with therapy. Those are musculoskeletal issues which we can help with so that women don't just have to suffer in pain. They can actually get relief for that. And then lastly is preparation for birth. I think that most often people in the United States are giving birth in hospital based settings on their back. They're getting induced. There's not a lot of coaching going on in that birthing situation. And during pelvic floor therapy, during pregnancy, we teach them like how do you push, different ways to breathe, different ways to labor and help labor progress. The things that I think it's like you're going to run a marathon that weekend, but you're not training. And so, how do we help train moms for that birth experience? That's what we do during pelvic floor therapy.
That's amazing. Man, I wish I had had that.
Well, and I did have that. And this is 10 years ago when I had my first son, and I was a pelvic floor therapist, and I had amazing births and I had amazing postpartum recoveries. And I thought, like, why am I the lucky one that chose this path that, yay, my vagina gets to show up? But
Right.
every woman should have access to this information. And that's what prompted me to start my Instagram 10 years ago, because I was like, everybody needs to know this. It should not be gate capped. Like, this needs to be out there
Right.
to help women.
Yeah. And are insurances covering PT during pregnancy for the pelvic floor?
If you have a condition that you can get referred for, so if it's like back pain or constipation or diastasis recti, if you go to a clinic or a hospital based clinic where they take insurance, it can get covered. But there's a lot of clinics that are cash pay,
Mhm.
and you don't necessarily have to have something that you can go for kind of what we call wellness, which will include
Yeah.
childbirth preparation. And, the app that I created, the VHive app, has an entire pregnancy series with all of this birth preparation stuff, because I think you may not want to go to a pelvic floor therapist. You might not have the ability or the time or even the resources. And so there's a lot of at home options for you to get this education and training.
Yeah, that's amazing. Yeah, sure. There's rural areas that don't have this. And pelvic floor, because it is a specialty within PT, not even all PT offices have the specialists.
Correct.
So that's, it's an access to care issue too.
Yeah. And there's just not enough pelvic floor therapists to see all of the women in this country and obviously throughout the world that need this support. I do think that that's the beautiful thing about medicine right now, is that we have so many different avenues of access. It's no longer just in-person care. It can be telehealth, it can be an at-home app, it can be in person. So there's just a lot of resources that I think are helping to make this info more accessible.
Yeah, I absolutely agree. All right, so we got the lady through pregnancy. She had her baby. Now she's postpartum. What does that look in pelvic floor physical therapy?
We typically wait until about 4 to 6 weeks to see folks in person, but you can do kind of remote or telehealth between then. I like to have them check in with their medical provider first. But again, after birth, we know that there are pelvic floor changes for whichever type of birth that you had. Whether you had a C section or a vaginal birth, your pelvic floor has changed.
Hmm.
And then, depending on the type of birth you have, over 30% of moms in the US are having cesarean sections for birth right now. That changes your core strength. You may have scar tissue restriction and pain. That scar tissue restriction can lead to painful bowel movements, painful periods, painful sex, and complete bladder emptying. So we do a lot of work on the scar for cesarean births and then core strengthening. For vaginal births, sometimes I see women and they're doing beautifully and they have, minimal tearing. Their healing is great. And we're like, let's get you back to exercise. And now there's research to say even exercise before 6 weeks is recommended, which is great. It's kind of giving us this free pass to, do the things that help us feel good, especially mentally. But we do core strengthening, pelvic floor strengthening or relaxation, scar massage to the perineum if they've had a tear, aches and pains, just, and if you are lactating or breastfeeding, you typically have vaginal dryness from lower estrogen levels, and that can lead to painful sex. At 6 weeks, you get this thumbs up to go back to sex and exercise, but your pelvic floor has 50% of the strength it had pre birth and pre pregnancy. So we need to help you rebuild that foundation to decrease pelvic floor issues long term and to just help you be more comfortable and be able to exercise without leaking and have sex without pain.
Yeah, absolutely. And I think it goes back to your earlier point of educating the next generation. I didn't get this kind of care. My kids are 17 and 19. It was not mentioned to me. It was not told to me. I had two C-sections for various reasons. And, I still, to this day, I deal with a slight prolapse. I deal with, the urgency and frequency and things like that. And not to the same degree that I did then, right? I've done my exercises, I do my due diligence, but I can only imagine how much better things would be for me had I had someone say, hey, you should really go to these exercise classes, do these exercises, get this help, not having to splint when I have bowel movements and things like that, that could have all been prevented. So, yeah, I think it goes back to let's educate the people now who will benefit from it and kind of help support them so we have less prolapse and issues down the road.
Absolutely. And I think it even, for us as moms, as women, but even as health providers, I think that it goes a level beyond where we need to educate the medical providers, get this
Huh?
training to residents, to medical
Yeah.
students, to attendings, because If they're not understanding the role that therapy and pelvic floor health can play, then it's not getting even evaluated. It's not getting asked about or screened, and then therefore not even getting referred. And so there's so many layers, I think, from not just bottom up, but top down, that we can really start thinking about pelvic floor healthcare and how it can be integrated into all of these different subspecialties to help better care for women.
Yeah, absolutely. I'm right there with you. All right, let's get into my favorite area because this is where I'm at in life. So, perimenopause and menopause, our hormones are all over the place during perimenopause. You start to have symptoms of vaginal dryness. I frequently see women coming in who have never had bladder issues, and all of a sudden they're having frequency and urgency and leaking. So one of my favorite things is putting them on some vaginal estrogen to get that estrogen back in those areas, get those tissues healthy and thicker again. But I also love sending them to you guys. So talk about what are you doing for women in this perimenopause phase?
I am also in this perimenopause phase. And I think right now moms are having babies later in life. And so we're
Hmm.
going from postpartum to perimenopause in one blurry season. And sometimes you don't even think, oh, are some of these symptoms I'm experiencing actually perimenopause versus just like some postpartum symptoms? So, some of the things, as you mentioned, that I think first people might be experiencing are vaginal dryness, painful sex. They might have some mild bleeding during sex or afterwards. Also, more frequent urinary leaks, like, oh, I used to be able to cough without leaking, and now it's starting to happen. Urgency of urination. So, having to go every hour and a half, waking a couple times at night. That didn't used to happen. Um, Urinary tract infections is another one as well.
Big one.
Yes, big one. And so, but we're not connecting those things to our pelvic floor and vaginal health. Topical estrogen is like the best thing I think you can start during this time because it works very locally on the vulva and vagina. When you are going through perimenopause, you have decreased estrogen, which therefore means you also have decreased collagen. So, decreased estrogen is what can lead to some of the dryness, thinning tissues, but also that decreased collagen. Collagen is a support tissue. We think of it in our face and it gives us nice plump cheeks and forehead. But when you don't have that in your pelvic floor, you can start to get more pelvic floor weakness. Some of the sphincters don't stay closed as well to hold in urine and stool, and you can start to have pelvic organ prolapse. So, I often encourage women during perimenopause to start training their pelvic floors before they even have symptoms, or if they have symptoms, to start addressing them right away. So, if it's a weakness issue, we work on strengthening, which is not just Kegels. I still think we're like, oh, let me just squeeze my vagina and on my Zoom calls and I'm good to go. But that's not
Right.
when you have urgency and leakage. You have urgency and leakage when you're exercising, when you're walking to the bathroom, when you're trying to get into the door at nighttime and you've got this key and door syndrome to go pee. So we do strengthening, but in different positions. We work on bowel health as well. If you're constipated, which can be a side effect of progesterone, GLP-1 medications, you know, certain overactive bladder meds. Full bowels will cause you to strain during bowel movements, and that can weaken your pelvic floor over time. So we address bowel health as well. And then I'm a huge fan of not just overall strengthening, but like really focusing on how do you bring this pelvic floor activation into your day to day movements, whether it's lifting a box of Costco groceries or picking up a stroller for your kid or grandkid to put in the car, or even putting your luggage overhead. Like, how do you learn to activate these muscles so that you can get the strength you need from them over time?
Yeah, that's such a great point because so much of what we do every day affects our pelvic floor. And if we don't have good body mechanics, we're doing a lot more harm. And then we've got even more therapy to do to get back to where we should be.
Totally. And so it's just again, these things that nobody's ever taught us. And even when it comes to sexual health, I mean, these muscles help give you more sensation during sexual activity because it can thicken and strengthen the muscles of the vagina. You can have stronger orgasms because these are the muscles that contract and relax during an orgasm. So if you start to see some of those things diminish, like less sensation, weaker orgasms, or the inability to have an orgasm, it's the hormonal piece, which I think is getting so much more awareness and coverage right now, but it's also the muscle piece that needs to be tended to.
Yeah, absolutely. And I think it's really interesting how deep into the layers that this goes and just the absolute disconnect in what we were taught and how this connects with the phase of our life and all that. Because I mean, I have just seen in my patients so much improvement with pelvic floor physical therapy and vaginal estrogen to the point where they don't need the overactive bladder medicine or they don't need the Botox injection. those kinds of things where it's been life changing for a lot of my women. And we have to take this stipulation of age off of it because, just because you're in your early 40s does not mean you're already not, or doesn't mean that you're not in perimenopause, right? Most of us start perimenopause up to 10 years before we actually hit menopause. And so, early 40s, if you are starting to have these changes, guess what? You're in perimenopause. Go talk to somebody about it. Get your hormones balanced. Get some topical estrogen, get yourself a pelvic floor specialist because it'll make that whole transition so much better and more effective for you and hopefully prevent having to go on some medicines that you really don't need.
Yeah. You know what? It's also a quality of life issue. I mean, if we're
Mhm.
living till 80 now and we're hitting perimenopause at 40, we have a second half of our life that I want to travel. I want to have great sex. I want to work. I want to exercise. Like, I want to socialize. And when you have a pelvic floor issue like leakage or pain, it really impacts your quality of life. And so, but we don't see it. It's not a cast that we're wearing on our arm or a brace we're wearing on our knee. These are very kind of invisible experiences, which I think is why it's one, we don't talk about them a lot, right? Because you can be, walking around thinking like, oh, where's the next bathroom going to be? Are my pants wet? Am I smelling? And people don't see that kind of dysfunction, but it's very real to you. So one is that we've got to start talking about it, right? We need to make these conversations louder, more frequent, which is why I love being on here to chat with you because it's not the problems we want to normalize, right? I always say we don't want to normalize pelvic floor problems. We want to normalize pelvic floor conversations because then we can actually start getting the resources to help. And then I think, as you mentioned, we want to be proactive. I always say perimenopause, as scary as we kind of all think it's going to be of what we see on social media, it's like a flashing yellow light. It's like, hey, girlfriend, this is going to happen. These changes are already going on. Like, you don't have to wait until the actual day of menopause to be like, okay, now what? We're getting a little bit of a runway to say, how can we optimize our health? So when we hit that stage, we feel strong, we feel empowered, we feel informed, we're already active, we already have these practices in place so we can navigate that next season with a better quality of life and better outlook.
Absolutely. And I think about, patients who are in a relationship. All of a sudden, they start having pain with sex. They start having vaginal dryness. They've never had that before. Now they have to negotiate those conversations with their partner and say, it's not that I'm not interested. My body is just not lubricating the way it used to. It's not that I don't want to, but it really hurts now. Or I can
Yeah.
only go for 5 or 6 minutes where we used to be able to go for 10 or 12. That friction just is too much. I'm sore afterwards. It's painful, things like that. So, how do you help women specifically with some of those like sex related issues?
One thing in my clinic, I say like your partner's always welcome to come in. Like let me be the messenger so that they can understand what's going on and it really becomes a couple issue versus a me issue.
Yeah.
So I can imagine if my partner had challenges, I'd be like, what can I do for you to help? Sometimes I absolutely recommend using a lubricant. I always say if it glitters, tingles, glows, sparkles, don't use it on your vulva or vagina. But there are some really great water-based, oil-based lubricants that are non-irritating. And again, that's not an issue of arousal. That's an issue of hormones. Like it's literally like dry mouth, right? And so it's how can you just incorporate that in to make it like less of an issue? It's also like what feels good to you may change. So you've got to be able to communicate with your partner. I'm a big fan of self stimulation or masturbation for my patients because I say if you can't communicate with your partner what feels good, because that might be hard because you don't know what feels good. Is it clitoral stimulation? Is it vaginal stimulation? How much foreplay do you need? So it's things you're shifting in your body. And I think to kind of explore that, we need to make it okay. And I also tell them, like, you are not broken. This is literally, it's like a paper cut on your finger, right? Like nobody's like, how could you do that? Like you're falling apart. It's like, or if their muscles are tight or tense, I'm like, if you have a headache, you're not like, I'm broken. You can have muscle tension in your pelvic floor and that's what's causing pain. And so it's just kind of really breaking it down to a very anatomical level to say, like, hey, if these issues were anywhere else in your body, you wouldn't feel the way that you do about them. But it's because they're in this intimate space that there's
Mhm.
a lot more that goes into it. So let's kind of pull back from that and address the muscular tissue issue and then help kind of reintegrate what feels good because pain is not normal.
Mhm.
And I don't think we should ever just have to deal with it, right? Sex should be pleasurable for both parties. And I don't think we should get to the point where we're like, I'm just going to suck it up and deal with it and it'll be over soon because we don't deserve that. And so I want us to kind of for longevity of intimacy and even our own lives know that there are options for relief.
Yeah, absolutely. And I think, as we look at men who get older and erectile dysfunction becomes such the norm, essentially, because by age 50, 50% of men have some level of erectile dysfunction, and it goes up 10% every decade. So, you know, if we're willing to accept that so easily and have all this help out there for guys with their erections, we should also easily say it is pretty normal for women to have sexual changes during perimenopause and menopause. That can be a plethora of different things, but almost always is going to include decreased lubrication and some type of pain if we don't help her. And I think
Right.
it's so important to get that education out there and then also have providers who are sensitive to that and willing to work with them.
Yeah. And I think it's helpful for people to know like they're not alone. Like I see women
Mhm.
every day in my clinic with these issues. I've written an entire book about how to overcome sexual pain
Yeah.
and, at every stage of life. So, 1 in 3 women will experience pelvic pain at some point in their lifetime.
Mhm.
And I actually think that's an underreported number.
For sure.
So this is happening. It's not you. You're not alone. We're just not always thinking about, what are my options? We're kind of just dealing with it, hoping it'll kind of go away.
Yeah, absolutely. And I think, having resources out there like your book, like your app, things like that for the interim of where do I go? How do I get started? Maybe, sometimes pelvic floor specialists, because they're in such high demand, can't get you in for a month or six
Right.
weeks. So maybe something can help you in the interim of getting in with someone. And I love your discussion of lube as well. I'm a big fan. I think that it's really important to get a good quality lube. I
Yeah.
always say no more than 3 to 5 ingredients should be in your lube. So, very similar to you, if we've got all this other extra stuff in there, it's not right for you. You're just going to increase your friction issues and your irritability, your infection issues, things like
Yeah.
that. Yeah, huge proponent of using lube. Do not feel bad about it. Do not feel like you are broken, like you said. It is just a change that we go through. And yeah, I think, there was such little education on having pleasure with sex, and that sex was for procreation and for the enjoyment of our partner and that connection, but it wasn't really about the pleasure, right? I don't think any of us had health and human growth and development in high school that was like, make sure you get your orgasm and let's talk about how to do that and all this stuff. Like, that was not talked about. So the fact that we could now have this conversation and help people realize we want you to have pleasure, not just the physical act of getting through it,
Right.
and really helping them find the tools to do that.
Well, and it's interesting too because libido and desire also decrease with
Mhm.
hormonal changes and using SSRIs or antidepressant and anxiety meds. And so we have that compounded factor of like, oh, I just don't even have that much desire. And then you layer pain on top of that. You're like, well, I don't even want to go near it. And
Yeah.
so again, it's not your fault. It's these are literally changes your body is going through to kind of demystify that, but also say like help is available. And
Mhm.
sometimes it's a combination of the topical estrogens or like a DHEA suppository and a lubricant and pelvic floor relaxation tools and all of and then bringing your partner in as well. There's another thing that I want to mention. We do also use these devices called vaginal dilators or vaginal trainers. And they look like tampons of different sizes, but we coach our patients on how to insert those at home. We have their partners start inserting it for them to kind of bring them into that experience and that practice. And then that can be something that they use to kind of relax the tissues and muscles prior to intercourse. It's like training. I'm like, it's like stretching
Mhm.
before you run a race.
Yeah.
There are lots of tools out there to help you experience more pleasure with sex.
Yeah, absolutely. And I love the dilator comment because, especially for women who have gone through menopause, now they're postmenopause and they've gotten none of this education. Nobody helped them through it because hormones were bad for so long because we got misinformation. And now they're too tight. Maybe they haven't had a partner in years, something like that. And I think the vaginal dilators are huge. That's
Huge.
so good for these ladies.
Yeah. And it helps you feel like you can do something at home. Like you don't have to go see a therapist to do that, right? You can bring your partner in to do that. I mean, you could put on heated rivalry and do that. So, like
Yeah.
there's lots of options to do things at home that make you feel like you have some control over an experience you often feel like is out of control.
Yes, absolutely. I know I had a female patient who her husband had passed. He was not very well endowed, and it had been several years, so she had nothing. And now she was dating somebody and they had tried to have intercourse and he was larger than her husband had ever been and she hadn't even had sex in years. So, I was able to get her in with a pelvic floor specialist and that was one of the things they did with her was the dilators just to help her get used to that, and grow and whatever. And, it took time. It wasn't an overnight thing. It was several months later that I saw her, but they were able to have that intimacy again and it was so great to see that joy and that excitement on her face when she thought she was done.
Yeah. Isn't that awesome? I mean, you just a whole new lease on life after
Yeah.
that. And so I love that story so much of just what's capable and what's possible. But if she hadn't had you as a provider to say, hey, this is where you can go for help,
Yeah.
it would have happened.
Yeah. And, so thankfully there are good things about AI. There's plenty of bad, but there's good things. You can type into Google now, I haven't had sex in 5 years and I'm trying to have sex. What do I do? And hopefully one of the things they will suggest will be pelvic
Yes.
floor physical therapy.
I'm going to go check that after this call.
Yeah. Right. we'll exchange Google Notes. Yes. But I think it's great that there are, different avenues for people. You can do the app in your comfort of your own home if you're rural or you just don't have the ability to go. You can go to a specialist. I always suggest, tell me how you feel about this. I always suggest to my patients who are super busy, career oriented, can't take time off of work for physical therapy. I'm like, can you please go 1, 2, 3, 4 times, learn the exercises, have them do their assessment to help you figure out where are you weak, where are you strong, so they can help you develop those. And then if you can't go back on a regular basis, but maybe every 6 weeks to get reevaluated, get a new exercise program, something like that, maybe that's a route that people can take. How do you feel about that?
I feel great about that. I think that that's actually the experience most of my patients has. I always say you're going to come once a week for 4 weeks. As you start getting better, we're going to space these visits out to every 2 to 3 weeks and then maybe once a month. And then, my goal is also to build up your toolbox at home, like
Hmm.
lubricants, posture, exercise, dilators, strengthening. I mean, it's to help you have the tools to kind of help yourself. We always say, like, we want to
Hmm.
teach the fisherman to fish, right?
Yeah.
And then you come back to me if something changes, if there's you need a tune up, if it's, 6 months or a year. I have many patients who just kind of come quarterly or semi annually, and they're just like, I'm training for a race. I want to see where I am. Or we're getting ready to have another baby. Like, can you tell me what's going on? Or I just started
Yeah.
this new hormone. So, like, I want to check in. So, again, kind of the dentist model. We haven't thought about what do we need to kind of really optimize health of our pelvic floors, but some consistency, but then we also need to kind of be on our own. We don't
Hmm.
need this every week for the rest of our lives. We need to have tools and then a place to check in if something changes. So I love that. And there is so much you can do at home.
Hmm.
I think through our conversation, we've talked about a lot, and it tends to feel like, oh my gosh, this is another thing on my to do list. But again, as you mentioned, there's so many things you can just kind of fit into your day to day
Hmm.
life already with workouts you're already doing, during sex, things you can already do, just postural changes you can make, just learning how to pee and poop without
Yeah.
straining. All of those things are things we already do. We're just adjusting them. So it's not such a kind of big lift to really make some of these changes.
Yeah, I remember a patient coming back being like, I didn't know I was pooping wrong my whole
Right.
life. No one told me I was pooping wrong. Like, I'm supposed to breathe out with this and in with that. And I was doing the opposite. And it was hilarious to me. But it's so true. You don't know what you don't know. And if you can go and use these resources and get the help, it's so important. You mentioned posture, and that's
Yeah.
something we haven't really talked about. Tell me, what am I looking for in good posture for a pelvic floor?
So the first things are kind of how you're peeing and pooping. So for peeing, I say like sit down on the toilet, don't hover. I
Hmm.
get there's some really gross bathrooms and you have to do that every once in a while, but it shouldn't be your standard practice. Lean forward and don't push. Just take some big deep breaths to allow your bladder, which is a muscle, to empty the urine for you. You don't have to push when you pee. That could lead to incomplete bladder emptying and it can also weaken your pelvic floor muscles over time. With pooping, we talked about using the squatty potty or stool under your feet, leaning forward, and then exhaling. I always tell people don't hold your breath to push out to poop. You want to exhale like you're blowing out a bunch of candles. And then posture, like a lot of us are sitting a lot all throughout the day. And oftentimes I see my kids doing this all the time on screens. They do what's called sacral sitting. So they kind of tuck their pelvis under, they're kind of hunched forward. You want to be sitting more upright on your sit bones. So kind of a L shaped putting a stool under your feet, having a pillow behind your back to reach the back. But when you sacral sit, you kind of crunch those pelvic floor muscles up and they get tight and tense. It could also lead to tailbone pain. And then if you're like twisting your legs up like a pretzel, turning your legs in, crossing your legs to the same side all the time, that just tends to create a little bit of muscle imbalance where that could lead to some overactivity in the muscles. So that's one. And then, postpartum, I think I see the biggest changes in posture with moms where they're, like longer abs, sway back, kind of weak abs. And then they tend to just pop a baby on one hip and then one hip gets weak and one hip gets tight. And so those kind of adjustments to keep a more balanced posture.
Yeah, for sure. I remember putting on pre-pregnancy clothes after I had my kids, and not only was I still too heavy for them, but like your hips change.
Right.
Your everything changes. You're not going to be the same that you were even if you go back to the same weight.
Yeah.
It's such a difference after having kids.
It's a difference, and there's grief. I think it's one
Yeah.
of the things that we always feel like we're having to sacrifice our bodies. But I think just kind of knowing the normal, like, hey, some of these things are normal, and some of these things you can work on to decrease your back pain. Like, I've had moms that are like, every time I pick up my kid, my back hurts. I'm like, okay, well, are you bending at the knees? Are you bending at the back? Like, just these things we're not even thinking about. Or
Yep.
I'm a petite person. It's like, how do you get your baby out of the crib? I'm like, put one foot on a stool. She's like, oh, I never thought about that. And so it's
Yeah.
like these little things that we can really teach people that make a huge difference.
Yeah. Amazing. I absolutely love your profession and you are awesome and so good at it. I want to give you a second again to go ahead and plug it so that people know how to get in touch with you, how they can work with you, find your book and your app.
Well, thank you for having me. This was such a great conversation. It's just always great to work with other medical providers who kind of know the synergy that we can have to really best help our patients. So my name is Dr. Sarah Reardon. I'm known on social media as the Vagina Whisperer. So if you're on TikTok or Instagram, my handle is the Vagina Whisperer, where you'll see tons of videos all about pelvic floor health and posture and exercise. My website is thevaginawhisperer.com, where I have a quiz you can take that can tell you like if you need to start with strengthening or relaxation. You'll find out more about my app there. And you can start doing exercises free. Everybody gets a 7-day free trial. So you can kind of see what does a pelvic floor workout look like, or if you're waiting to go in to see a therapist, I think it's a great place to start. Or if you've even finished therapy and you want to keep up with your home exercises. And then my book is called Floored, A Woman's Guide to Pelvic Floor Health at Every Age and Stage. It's a great book for partners. I've had a lot of partners reach out to me and said, I had no idea that this is what was going on. Like, thank you. And it's a great book for you. I think it's just to help you better understand your body, be able to advocate for it, and to be able to get some tips and tools at home to get started.
That's awesome. Yeah. And everything will be in the show notes too, you guys. So if you're driving right now while you're listening, please don't try and write anything down. We
No,
will
you
get
can
those in
literally
the show
just
notes.
Google the Vagina Whisperer and everything will pop up.
Yes. I love it.
It's not hard
I
to
love it.
find.
Yes. This was such a great conversation. Thank you so much for being here. Everybody, I hope you have a great week. Don't forget to check out reviveish.com for your hormone and sexual health needs at the Revive Institute of Sexual Health. Thank you again for being here and go have some fun between the sheets. Thank you for joining us and exploring sexual health topics here on Between the Sheets. New episodes are available every Wednesday. Please subscribe and rate our podcast so we can reach more listeners. And don't forget to tell your friends, partners, and anyone who will listen about Between the Sheets. Send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. It's all one word, podcastbetweenthesheets@gmail.com. Thanks for listening and go have some fun between the sheets.